The data is reported in terms of what the adverse events were. So you can imagine that they don't always overlap. So I think the idea that some of these agents can cause fatigue is not new, because these agents are available in metastatic castrate-resistant prostate cancer. So many of us have some experience already treating these patients in a more advanced setting. But in terms of some of the falls and fracture risk, I think in the older men group, like greater than 75, we saw a little bit of a higher incidence of that when compared to placebo. So you wonder if that's a balance issue, if there's some neurologic toxicity, something to consider. I think that we always worry about neurologic toxicity, however that's reported out. You know, I think in real life practice, you worry about balance, and just the cognition is sort of impacted. And you know, one of the drugs, darolutamide, for example, in their write-up, in their publication, does mention that perhaps due to its unique mechanism of action, it doesn't have such a big, you know, blood-brain barrier impact, so that maybe the neurologic toxicities is less, and that's certainly borne out by the study. On the enzalutamide trial, there were more cardiovascular deaths, a little bit unexplained, you know, not a huge amount, but enough where I think many of us who recognize this is a fairly asymptomatic group, it makes you think about it a little bit more. So perhaps if the person was already having some cardiovascular compromise, that may not be the way to go, and at least you have two other options to consider. So the great part is that we have an option to consider 3 different agents, and we can tailor those, you know, treatment decisions based on the patient.